Sometimes autoimmune hepatitis can also be there, but today's discussion will be restricted only to viral hepatitis. Now, if we look at all the viruses that are responsible for causing inflammation of the liver parenchyma, there are two types of viruses basically. One type of virus, also known as the hepatotropic virus, that means these viruses have much more higher affinity for the hepatic tissue than other viruses. Other viruses would include viruses which can cause inflammation anywhere in the body, including liver. So, if we'll do classify, then we'll find that there are a group of viruses called as hepatitis viruses and the other viruses which cause systemic illness, including yellow fever, Coxsackie, Epstein-Barr virus, cytomegalo, herpes simplex. These viruses causes inflammation throughout the body. But the group of viruses known as the hepatitis viruses, they are known to be causing inflammation predominantly in the liver. Okay. We'll consider each of them one after other. Now, what are the hepatitis group of viruses? These group of viruses are hepatotrophic. They produce acute inflammation of the liver and have identical histopathological findings. That means the way they cause inflammation is more or less similar. Hence, they are grouped into this group. Furthermore, any inflammation of the liver will manifest in particular clinical manifestation, including fever, nausea, vomiting, and jaundice. Okay. Now, among the hepatitis group of viruses, we'll discuss about the major viruses. Some of the viruses may be acquired by fecal route and some may be acquired by other means, including sexual and blood transfusion products. First, we'll consider about hepatitis A. Now, what is hepatitis A virus? Hepatitis A virus was previously classified as enterovirus, but then reclassified as hepatitis A. Why enterovirus? As the name suggests, that means this virus's transmission is through the enteral route, that is the fecal-oral route. Okay. Then this virus is size of 27 to 32, icosahedral symmetry. There is only one serotype of virus of hepatitis A. That means all infections are caused by one serotype only. This is the reason why vaccine against this particular serotype can help in prevention of the infection. So, this is one of the vaccine preventable hepatitis viruses. As I have already said, the transmission is by fecal-oral route, predominantly through water and raw or uncooked foods. Okay. Now, because it's an enveloped virus, so all the preventive measures that are taken for other enteral viruses will also be justified in this case. Now, if we look at the host, the predominant hosts are humans. Most commonly affected are children and adolescents of the age 5 to 14 years. However, most of the cases remain subclinical. That means there is little or no manifestation. Yet, the virus is secreted in the feces for a prolonged period of time. What is more interesting is in adults, clinical manifestation, that is icterus. Icterus means clinical jaundice, is more common as compared to children and adolescents. That means children and adolescents are the predominant spreaders. So, if we look at the ratio, anicteric to icteric, that means almost asymptomatic or subclinical cases to overtly clinical cases. In children, it is 12:1, where in adults, it is 1:3. So, the risk factor would include very simple poor hygiene and overcrowding. This virus is responsible also for outbreaks. as I think you have already understood the transmission by fecal-oral route. So in overcrowded areas, people living with poor hygiene conditions, outbreaks are very common. Now, another important part is the seasonal variation. The peak is at the late rainfall and early winter period. Obviously, in a subtropical country like India with the monsoons, flooding of water resources, after which this infection is very common. The virus excretion occurs 2 weeks before to 2 weeks after the appearance of jaundice. This is can be determined only in case of clinical cases, but in subclinical cases, obviously it will be completely unrecognized. What will be the clinical manifestations? Obviously, there will be two phases, pre-ecteric and ecteric phase. Pre-ecteric phase means common sign symptoms. There might be fever, malaise, this sort of symptoms. Whereas in ecteric phase, it will be dark urine, yellowish discoloration of sclera and mucous membrane, that is clinical jaundice. Incubation period is about 15 to 45 days. Now, most of the people, especially the children and adolescents, will recover without any kind of sickness. And there are no chronic or cardiac state. Why? Because only one subtype. So, after infection, the body provides the immunity, and that immunity does not let the infection to become carrier or a chronic infection. I'll describe it later. So, most of the cases will be subclinical, but sometimes in clinically or manifested icterus, the outcome may be of three types. One is fulminant hepatitis. Fulminant means it will progressively increase and may even cause death in the patient. Sometimes it may cause relapsing hepatitis. That means the patient gets better and then again the virus starts replicating and the patient manifests again. And sometimes it may lead to cholestatic hepatitis. Cholestatic hepatitis means the bile, drainage of the bile is altered and there is accumulation of bile salts. So these could be the manifestation. Now, how to diagnose a case of hepatitis? Obviously, the patient will have clinical manifestations and sometimes may not have. So we can easily detect by anti-hepatitis A virus antibody, commonly detected by the ELISA method. Two antibodies we can detect, IgM and IgG. Obviously, IgM indicates an acute infection, IgG indicates fast infection. Okay. Other methodologies include detection of hepatitis A virus particles by immune electron microscopy, and this virus can be detected about 2 weeks before to 2 weeks after of jaundice. Where we will look for this virus? In the fecal matter. Other than that, we can also detect the hepatitis A virus antigen in the stool. This is the direct diagnosis. Other ancillary diagnosis will be estimation of the liver function test, which will reveal elevation of the hepatic enzymes and elevation of the bilirubin. If we look at the progression of the hepatitis A virus, this is the chart, if you can see. So, before the signs and symptoms, suppose the infection is acquired on day 0, after about 3 to 4 weeks, the patient will start becoming symptomatic. The liver enzymes will raise along with the symptoms. So will be the antibodies. However, if we look at this, the virus is present in blood and fecal matter about 2 weeks previously. Okay, understood? Now, treatment. There is no specific treatment. So, the management is basically symptomatic. Coming to prevention, if there is no treatment, then we need to concentrate more on how to prevent. Now, who are the main reservoir? It will be the children and adolescents who are asymptomatic. How is it transmitted? By fecal-oral route. So what are the preventive measures that we should take? Hand washing, enveloped virus. So any soap material will render the virus non-infective. Similarly, use of disinfectant and use of purified drinking water. Okay, either by filtration or by using boiled water. Especially in resource limited setting, boiling of water is sufficient to prevent the infection. Now, vaccines are also available. I have already told you only one serotype. So, the vaccines can be given. However, children less than 1 year should be avoided. That means it should be given to all children more than 1 year of age and to people who are traveling from a non-endemic country to an endemic country. For example, India is an endemic country. So, any person who is traveling to India should ideally get vaccinated. And people who are living with chronic liver ailments. Why? Because the same infection may be mildly symptomatic or asymptomatic in other patients, but in person who have already compromised liver function, it may result in fulminant hepatitis. So there are two types of vaccines. Obviously, one is a formaldehyde inactivated vaccine and other is a live attenuated vaccine. Both vaccines are highly immunogenic. Other is sometimes the patient may develop fulminant hepatitis. At that point of time, the only treatment methodology remains human immunoglobulin. But it is some people should only be given, like those who are already vaccinated, casual contact, and elderly people who might have serious adverse reaction. That was all about hepatitis E. Moving on to the next virus. The next virus that was identified was called as hepatitis B virus. Now this virus, unlike hepatitis A virus, was a DNA virus and the transmission was not by fecal-oral route. It is transmitted by predominantly transfusion or blood of blood products and sexual transmission. If we look at the morphology, we can see the virus has many morphology. For example, you can see this spherical form and there is a tubular form. Also, you can see this large spherical form. Can you see? This is the small spherical form. One is a tubular form and a large spherical form. It is called the Den particle. So, what is a Den particle? It is a virus without the nucleic acid. Okay. So, the Den particle only has the outer surface envelope and the inner nucleocapsid. Now, if we look at this, the spherical and tubular form are made up of what is known as hepatitis B surface antigen. Keep this in mind. This will be important later on. Now, this surface antigen was called previously Australia antigen and there are many types. It contains two components. The common group component is the A type and two pairs of specific D or Y or W or R. The permutation and combination leads to four subtypes: ADW, AYW, ADR, AYR. Just look that every one of them has the A antigen. That means antibody against this surface antigen will result in protective immunity, irrespective of the changes of the subtype. So, what is this surface antigen? It forms the intracellular core protein. It is not secreted, does not circulate in blood, and can be demonstrated within hepatocytes. Another antigen is known as the E antigen or called as the pre-core antigen. Now, this non-particular soluble antigen, it represents the signal protein which is secreted. It is present in the circulation. What does it imply? It means that the virus is being replicated within the body. Now, coming to the serotype, in India, there are two common types, ADR and AYW. ADR is present more commonly in the eastern India and AYW in the western India. Based on the genotype, there are many genotypes. A to J, group D is more common in India. If we consider the viral genome, there are 4 genes: S gene, C gene, X, and P gene. Now, S gene has 3 regions: S gene, pre-S1, pre-S2. The S gene codes for hepatitis B surface antigen. This might be a little bit boring. Just try to understand this, because there are variants of this virus which are very difficult to diagnose. Okay. The C gene or the code gene has a pre-C and the C gene. The pre-C gene codes for the E antigen and the C gene codes for the C antigen. Okay. The X gene codes for the X antigen, and this may contribute to pathogenesis by binding to P53 antigen. Sorry, PP53. This may result in hepatocellular carcinoma. So, long-term or chronic infection or hepatitis B may lead to hepatocellular carcinoma by this route. Next is the P antigen. The P antigen codes for the polymerase activity. This results in the translation from the DNA to the RNA. And because it's an incomplete DNA, first step is always completion of the DNA. Why this is essential? Because there are mutations, and some mutants of this virus are very difficult to diagnose. These mutants are important. The 3 more common mutations are: number 1, the pre-core mutants, the escape mutants, and YMDD mutations. Now, what is the pre-core mutant? If you recall, the C gene had a pre-C and the C gene, right? In pre-core mutants, the mutations in the pre-core, now the pre-C gene encodes for the hepatitis B E antigen. If that gene is mutated, what will happen? The hepatitis E antigen will be not produced. If this is not produced, it becomes very difficult to diagnose. Why? Because I have already told you, presence of hepatitis B E antigen indicates active replication of the virus within the patient. If this antigen is not detected, then we cannot actually determine whether the virus is replicating by serological markers. For that, we need to go for exact estimation of the virus by other methods. Now, escape mutants have mutation in the S gene. This leads to alteration of the hepatitis B surface antigen. If the surface antigen is altered, then vaccination might not be effective in these cases. Because I have already told you, vaccination against hepatitis B involves the surface antigen. So, the antibodies will be produced against the surface antigen. Now, if the virus produces an alteration of the surface antigen, what will happen? The antibody that is produced within the body will fail to inactivate the virus. Understood? These are 2 more important. The other one is the, now, escape mutants is observed in 3 particular situations. One is infants born to hepatitis E antigen positive. That means in the mother, the virus is replicating actively and she has given birth to the child. Another, liver transplant recipients who underwent the procedure for hepatitis B and treated with human monoclonal anti-B surface preparation. Another small proportion of the recipients of active and passive immunization can also have alteration of this gene. What effect is underdiagnosis? By routine serology, we go for the panel testing of the antigens by serological methods. So, if in a particular patient the virus is of escape mutant, diagnosis can be missed. Other important part is vaccine failure. Why? I have already told you, immunity is produced by antibody produced against the surface antigen. If a particular virus produces an altered form of surface antigen, the existing antibody will fail to neutralize the virus. Another important mutation is the YMDD mutation. Just remember, mutation of this results in resistance to the drugs that are used for treatment. This will lead to therapeutic failure. Okay. For all purposes, you need to remember these three mutations. What are the mutants? One is a pre-core mutant, one is the escape mutant, and the YMDD mutation. Okay. Transmission is predominantly by parental route and sexual transmission. Just understand this, that the possibility of getting infected through blood or blood products is much higher in case of hepatitis B as compared to HIV. Generally, people are more scared of HIV, but please remember, hepatitis B virus can survive even in clotted blood samples. Okay. So this has a higher rate of transmission as compared to HIV virus. Other methods would be vertical, that is perinatal, and direct skin contact. So who are the people at high risk? Obviously, people who are dealing with blood and blood products, including healthcare workers, doctors, nurses, because of sexual transmission, sex workers, and intravenous drug abusers. These are the all people who are at risk. The reservoir of the virus is humans only. So there is a possibility of reducing the transmission and prevention of infection if we can reduce the reservoir of infection, that is human beings. Now, who are the reservoir? People with active infection, that is inapparent to symptomatic, that is active infection, or people who are carriers. Who are carriers? Carriers are those people who harbor the virus for weeks to months, or people who have chronic infection. Okay. So transmission can be by all who are actively infected, who are carriers, or who are chronically infected. It is all geographical areas are divided into two types: low endemicity or high endemicity, based on the number of the cases. That is, carrier rate of less than 2% is considered to be low endemicity, whereas higher than 2% is considered to be as intermediate endemicity. Now, WHO estimates about 2.7 million people who are infected with hepatitis B and HIV both. And in India, it is about prevalence about 44%, and the disease burden is about 11%. That is 50 million disease cases. It is more common in states like Andaman, Arunachal Pradesh, and more commonly seen in tribal population. Now, the consequence of hepatitis B infection can range from a chronic hepatitis, development of cirrhosis of the liver, to hepatocellular carcinoma. Now, please remember, World Hepatitis Day is 28th of July. It is celebrated every year by WHO. One more important part is the resistance. So, how can you neutralize the virus if it is present in the setting? Most easily, it can be destroyed by hypochlorite. So, if there is spillage of blood or body fluids in a patient who is seropositive with hepatitis B virus, the best way to disinfect it with is use hypochlorite. Obviously, autoclaving will also render it non-infective. Now, people infected with hepatitis B virus are infectious as long as surface antigen is present in the blood, become non-infectious when surface antigen disappears and replaced by anti-hepatitis B surface antibody. Understood? So a person gets infected, virus starts replicating, initially will detect surface antigen, following which the body will produce antibody against surface antigen. Surface antigen will be neutralized and it will disappear, and now we will get antibody against the surface antigen. Maximum infectivity is observed when the E antigen is elevated in the serum. Okay. So maximum infectivity means maximum number of virus. That means it is an indication of active replication. Now, hepatitis B virus transmission is also similar to that of HIV. Hence, both the viruses can co-infect. Okay. So many people will have hepatitis B and HIV virus co-infection. Now, this is a chart which shows the various outcomes of hepatitis B infection. So, after an incubation period of 30 to 180 days, there will be acute hepatitis. Very rarely, some patient will end up with fulminant hepatitis. Less than 1%. Most of the patient will recover. Very few will develop either carrier or chronic hepatitis. Okay. Now, the carrier, that means who are carrying the virus for about 6 months. What will be their fate? They will either become chronic inactive hepatitis B infection, that means the virus is present but is not replicating. Other one would be immune tolerant, that means the virus is replicating at a very low number but the patient remains asymptomatic, that is, does not manifest. The people who develop chronic hepatitis will ultimately have either active hepatitis or inactive hepatitis. People with inactive hepatitis will ultimately end up having either liver failure, cirrhosis, or hepatocellular carcinoma. Okay? Are we clear about this? Next. Similar to hepatitis A, it will become either pre-ecteric or ecteric. Now, coming to laboratory diagnosis, these are the three antigens that are tested for: surface antigen, E antigen, and C or core antigen. The antibodies will be similar to that, that is anti-HBC antibody, anti-HBS antibody, anti-HBE antibody. Now, what do they indicate? If the core antibody is of IgM, it indicates acute hepatitis, and if it is of IgG class, it indicates that past infection. Okay. Surface antigen, presence of surface antibody against surface antigen will indicate that the patient has recovered or the patient may be vaccinated. Finally, presence of antibody against HBE, it would indicate low replication, means low infectivity. Understood? Other methods would be direct detection of the hepatitis B DNA, viral DNA, and non-specific marker including liver enzymes. Now, this is the chart which shows the infection. If the patient is infected at day 0, first you see that the surface antigen is produced, after which the antibody production starts. Then we can see by about 6 months the surface antigen disappears and is replaced with anti-HBS. After about 1.5 weeks, we can see the rise of the anti-HBC. Please remember, HBC antigen is not present in the blood. Okay, it is directly detected in the tissue, that is liver tissue. So we can detect only the antibody against it. As far as the HBE antigen, it is seen after 1 week, it rises and then slowly disappears when anti-HBE antigen starts appearing. Now, if we look at the hepatitis B viral particles, we can see that it is present in the early phase, that is less than 2 weeks. Now, if we correlate with the same thing with the clinical, we can see the 0 to 2 months will be the incubation period. following which there will be a prodrome where the surface antigen is present. Early convalescence, and after the prodrome in the convalescent stage, the anti-HBs will be present. Okay. Why this is important? Because whenever we are sending any patient for testing, we are only sending these tests. Based on the results of this test, we have to implicate at the stage where the patient is. That will determine the management of the patient further on. Now let us look it in a different way. Suppose this is the panel of tests that is sent out and the results are over here. Now look at the first. The surface antigen is present, all other antigen and antibody are absent. What does it indicate? That means the patient is acutely infected, that is in the early stage. Next, look at this. Surface antigen is present, but only IgM against the core antigen is present. That means it indicates acute hepatitis. If the E antigen is present, that means the virus is replicating very fast. That means it is of high infectivity. Similarly, if the IgM is replaced with IgG, it will indicate chronic hepatitis with high infectivity. Now, if the antigen is present, IgG is present, but the E antigen is not present, rather the antibody against E antigen is present, it would indicate it's a chronic hepatitis but of low infectivity. Understood? Now, if this is seen, that is the surface antigen is present, IgG is present, E antigen is present but no antibody against E antigen. However, the patient is asymptomatic and liver enzymes are normal. That means the virus is replicating at a very low level that is not manifested. It is called as the immune tolerant. Now look at this one. The surface antigen is absent and antibody against the surface antigen is also absent. IgG against the core antigen is present. But the E antigen may or may not be present. Antibody against E antigen may or may not be present. And the patient may be symptomatic, may not. This would indicate that this could be a possible escape mutant. Escape mutant, what happens in escape mutant? The surface antigen is altered. So look at over this one. The envelope antigen may be present, but the surface antigen is absent. Okay. If the surface antigen is absent, but the antibody against surface antigen is present, it would mean the patient has recovered from active infection. If only antibody against surface antigen is present, all other are negative, that means the patient has been vaccinated. Why this is important? Because the patient that you are trying to diagnose may or may not have been previously vaccinated. So you should know the status of the patient and you should have the ability to interpret the results. Have you understood this or not? Okay. So there are obviously treatment of hepatitis B. If more than 200 IU per ml of DNA is present, then treatment is done. Treatment is generally done by antiviral or interferon. Now, prophylaxis is rather very simple because hepatitis B immunization is done by intramuscular injection. According to the Universal Immunization Program, hepatitis B vaccination is done for all children. Okay. The objective is to vaccinate all human beings. Specific vaccination should be given people who are at a higher risk, including healthcare workers. So this is the dose. It is given at 0.16 months of schedule under the National Immunization Program given along with DPT. Now, this is important. What is the marker of protection? Some people may be vaccinated but do not mount an immune response. So we can estimate that by detection of the antibody titer. If it is more than 10, that means there is sufficient production. If it is less than 10, then revaccination can be done. Okay. If there is a sudden exposure with the blood or blood products by a patient who have a high level of virus in the blood, prophylaxis would be giving immunoglobulin along with vaccination. If the person affected has already been vaccinated, immunoglobulin will be sufficient. Okay. Moving on, another important virus is hepatitis C virus. Now, hepatitis C virus is also transmitted by post-transfusion and by sexual route. It belongs to the Hep C virus and is a RNA virus, and it is almost similar to HIV, have 6 major genotypes. And if you had read about HIV virus in depth, you will understand there are quasi-species. In India, genotypes 1 and 3 are most prevalent. Transmission is by parenteral, vertical or sexual route. Most of the infections will be asymptomatic like hepatitis B. Others will develop acute hepatitis. Some people may spontaneously clear. However, important part that you should remember that many patients develop chronic disease including extrahepatic manifestations like mixed cryoglobulinephritis, acute arthritis, and some patients may even develop hepatocellular carcinoma. The incidence of hepatocellular carcinoma and development of cirrhosis of the liver are more common in case of hepatitis C virus infection as compared to hepatitis B virus infection. The laboratory diagnosis is done by third generation ELISA or by estimation of the virus by nucleic acid amplification test. Now, as far as treatment is concerned, antivirals including interferon are given, and the objective is to achieve sustainable viral response, that is to reduce the replication of the virus. The virus may not be cleared, but ultimate objective is to make the patient symptom free and reduce the replication of the virus. These are some of the drugs that are used. There are no vaccines for hepatitis C virus. Hepatitis D virus is another virus which is also transmitted like that of hepatitis B virus, but it in itself is not capable of producing full-blown manifestation. It is commonly seen with infection along with hepatitis B virus. Now, this is also this virus is a defective virus, cannot replicate it. It's a RNA virus. Transmission is obviously will be similar to that of hepatitis B virus. Now, if it is infected along with hepatitis B virus, we call it as co-infection. Co means both the infections are present at a particular point of time. So, what is co-infection? When a person is exposed simultaneously to both the viruses. Now, the B infection sets in first, then the D infection sets. Okay. So, vaccination against hepatitis B virus can protect the disease caused by D virus. Another part is superinfection. What happens is when a chronic carrier of hepatitis B virus is exposed to hepatitis D virus. Okay. So, in co-infection, the person who was previously naive gets infected with both the virus at the same point of time. So, the B virus infection occurs first, later on the D virus produces its pathogenesis. Because as I have already said, hepatitis D virus is a defective virus. But in some patients, say a patient who is already infected with hepatitis B virus, a chronic carrier. That person gets infected with hepatitis D virus. Then it is called as super infection. It will manifest either in chronic or in acute phase. Now look over here, in the chronic phase, the incidence of cirrhosis and hepatocellular carcinoma is much higher, and it also results in a higher mortality rate. So these are differences you can see in co-infection and super-infection. So fulminant disease is more commonly seen with super-infection, chronic hepatitis is more with super-infection, and hepatocellular carcinoma is more with super-infection. Diagnosis can be done by detection of IgM against and IgM or IgG against hepatitis D antigen. So if IgM against hepatitis B C antigen and hepatitis D virus, it indicates co-infection. If we see the IgG against the core antigen of hepatitis B virus and the mixture of either IgM or IgG against the D virus, we call it as superinfection. Have you understood this one? Co-infection means simultaneous infection. So both the virus will produce IgM. If the hepatitis B has IgG and D has either IgM or IgG, we call it as superinfection. Okay. Other would be detection of hepatitis D RNA. It is not prevalent in Southeast Asia, including India. Next part of the hepatitis virus is hepatitis E virus. Now this virus, like hepatitis A virus, is also transmitted by fecal-oral route. But more importantly, it infects young people and is causing epidemics. That means many people might be infected at a particular point of time. It's a small RNA virus. There are 4 genotypes. Incubation period is about 14 to 60 days, and it may sometimes rarely cause fulminant hepatitis. The only point you should remember that if a pregnant woman gets infected, it may cause fulminant hepatitis more commonly. However, there are no chronic or carrier state of hepatitis E virus. It is mainly a zoonotic disease. The reservoir include animals and transmission is by fecal-oral route. Diagnosis is by detection of the antibody against hepatitis E virus, either IgM or IgG class, and there are no specific treatment or specific vaccine. However, China has produced a vaccine which is not implemented yet. Hepatitis G virus, just 5 minutes more. Just 5 minutes. Now, although the name is hepatitis G virus, you should remember it is not a hepatotropic virus and it does not cause hepatitis alone. Okay, there are many genotypes. It replicates in bone marrow and spleen and it causes systemic infection. Okay, that is why I have kept it. Hepatitis G virus is not a, although the name hepatitis G, it is not a hepatotropic virus. Okay. Finally, one important part is yellow fever. Now, yellow fever, the disease itself is not present in India. It is present in the African continent. However, you should learn about it because of national importance. Why? The virus itself is not present in India. However, the vector Aedes aegypti mosquito is present in India. Hence, if the virus enters in India, it can cause massive outbreaks. Okay. Why is it called yellow fever? Obviously, it's a febrile illness with yellowish discoloration of skin and mucous membrane because of the jaundice, and sometimes it may also cause fulminant hepatitis. There are 7 genotypes, none of them are present in India. They have 2 cycles, a jungle cycle and the urban cycle. Jungle cycle, obviously, as the name suggests, the virus is present in the animals in the wild. Now, in India, it is not present. However, the government has some taken some steps to prevent that this virus does not enter in India. What are those steps? The only important step is vaccination. So, vaccination is done. Okay, just a little bit. 3 to 6 days incubation period. It's a febrile illness. Severe cases may manifest with hemorrhagic manifestation and liver failure. IgM ELISA can be used for diagnosis or molecular methods. There is basically no treatment, only symptomatic care can be given. Most important part is this vaccine, that is the 17D vaccine. Now, from our perspective, what is the importance of this vaccine? Please remember two things. The vaccine is prepared from egg. So, any person who is having allergy to egg or egg protein should not be given the vaccine. Furthermore, it is produced in India in CRI Kasoli. Strict cold chain must be maintained and the dosage is given by subcutaneous. The vaccine starts becoming effective 7 days after administration and it lasts up to 35 years. However, for the purpose of vaccination certificate, the certificate is provided 10 days after vaccination and is valid for 10 years. Any person from India who is traveling to any country endemic of yellow fever have to be vaccinated with this virus. And because of the teratogenic potential of the virus, vaccination of pregnant women should be avoided as much as possible. So, because the validity of the certificate is for 10 years, you have to get vaccinated after every 10 years. So, contraindications of the vaccine would include children less than 9 months, pregnancy, HIV infected people because it is a live vaccine, and people with allergy to egg or egg protein. Okay, so these are the viruses which cause hepatitis. Along with all these viruses, other viruses I have already told you, like CMV, Epstein-Barr virus, herpes virus, they can also cause inflammation in the liver along with other manifestation. Okay, today's discussion was just on the hepatotropic viruses. Okay, so this group of viruses include the hepatitis virus, hepatitis A, B, C, D and E. Hepatitis G virus, although it is named as hepatitis G, it is not a hepatotropic virus. And finally, you should also learn about yellow fever. Although the disease is not present in India, but because the vector and the environment is sustainable for the transmission and maintenance of the virus, prevention should be done with the help of vaccination.